this week we have got a very special person who has joined us today, and that is none other than Dr. Sathish Devadoss. Dr. Sathish Devadoss, who's also a co-founder in Cureka.com. He's also an orthopedic surgeon, a highly regarded orthopedic surgeon specializing in the treatment of musculoskeletal disorders with a particular focus on spine-related conditions. With a distinguished career marked by expertise and compassion, Dr. Devadoss is renowned for his commitment to enhancing patients' quality of life. As a trusted authority in the field, Dr. Devadoss is dedicated to addressing the prevalent issue of neck and pain, especially among the IT professionals. His deep understanding of the unique challenges they face in their work environment has made him the most sought after expert in promoting spinal health. Dr. Sathish Devadoss' contribution to orthopedics and his passion for well-being have earned him recognitions as a leading figure in healthcare. His dedication to improving the lives through orthopedic care reflects his commitment to the holistic health of his patients and his broader community. So, without taking much time, I'm going to welcome with us Dr. Sathish Devadoss just about now. Good morning, Dr. Sathish.
Morning, Rahul.
Nice to have you today, sir. Thank you so much for taking your time out and giving it to our audience, who have been waiting a lot for understanding what they can do if they have some back and spine issues. Especially, a lot of people today are from the IT industry, so they want to get queries for their answers. So, Doctor, moving on to our first question for the day, and people, all of those who are joining in right now, whether you are from Facebook, Instagram, joining from LinkedIn, Twitter, we are live in multiple platforms. Guys, you can mention your comments in the comment section below, and we will try to take them up during this week's live session. So, Doctor, can you please explain some common reasons behind lower back pain in IT professionals who spend long hours at their desks?
So thank you very much, Cureka, for giving me this opportunity. It is really nice to be here because this is a very common issue which we find, especially with more and more the IT industry is flourishing in our country. And we see many people, I won't call them patients, they're all normal people, who would present to us with neck pain and back pain. Now, low back pain first, we'll take low back pain first, is one of the major causes for loss of, attendance, workplace attendance,
Yeah, correct.
loss of, revenue for the company, loss of productivity by an individual. So back pain is one of the very common things in
It looks like Dr. Satish's video has frozen. Probably there is a network issue. So in the meanwhile, we'll request the audience to please everyone join in and settle down. Today we are going to have a very, very special session with Dr. Sathish, who is the vice chairman at Devadoss multi-specialty hospital, and he has been a fabulous flag bearer of orthopedic care across the entire South India. So recently, Dr. Sathish has been spearheading also the robotic surgery. He has brought the robotic surgery back to in the very first time to South India in a small city called Madurai, and he has been helping a lot of patients with that. So ask all your doubts, all your questions, address them to Dr. Sathish, and he'll be very happy to take them in this week's live session. So guys, also at Cureka.com, we are making efforts to help you have a very good healthy living, and for that we are having a free of cost WhatsApp platform which you can use to ask your questions and get feedbacks and recommendations from the experts. So Dr. Sathish is live now. Welcome back, Dr. Sathish. Yeah, so please continue.
Seems to be some connectivity issues, but however, so like I was saying, low back pain is common in IT professionals because of long working hours, and this may lead to loss of their productivity
Yeah.
which is both harmful to them as well as their company people. But anyway, so the main cause of low back pain in IT professionals is usually due to a bad posture. So when you're sitting for a long time, the spine bone, there are 33 bones in this from the neck to the tail bone, and you have a shock absorber kind of device called as the uh, intervertebral disc. So this disc is like a rubber spring between each bone, which allows for some the movement, and it takes like reduces the forces acting on the spine bone. So this improves flexibility as well as it reduces the strain going onto the bone. So this is a very important structure, and this normally contains a gel-like structure inside, as and it's surrounded by a fibrous tissue, and it's very close to the nerves, which are spinal cord and the nerve, which is coming down your spine. So the spinal cord, in turn, gives many branches of nerves, which goes down your leg also. So what happens is sometimes when you're sitting for a long time, this disc, intervertebral disc, the pressures inside the disc become manifold, right? So your entire body weight will fall on your low back, and the uh, pressure in the disc becomes manifold. And if your chair is not fine, if you're not sitting well, your posture is not correct, your ergonomics is totally bad, then there is a very high chance for.
Right. So I believe there is a small network issue, and Dr. Satish would be back very, very soon. So in the meanwhile, guys, we have got our you can try using our WhatsApp platform and asking your questions. Yeah, Dr. Satish is back. Yes, sir. We are
Yeah.
here.
So when you're sitting for a very long time, the intervertebral disc pressures become manifold. Biomedical studies, mechanical studies have shown that the intervertebral disc pressure is the maximum when you're sitting for a long time. It is to a certain extent when you're standing and walking, and it is when you're lying down, it is normal. So lying down is the best posture for your spine, but you can't do that all your life. So sitting, you have to do it in a correct position, and you'll have to probably stand up regularly, take a walk, or nowadays people stand and work with just
Yeah.
a foot support,
Mm-hmm.
so that is also a good option for the spine. The main thing is to strengthen your spine muscles. So there, the spinal muscles have to be strengthened to take any of these strains which is happening in the disc. And when you, after sitting for long hours, you are traveling back on a two-wheeler or on a car or on a very bumpy road,
Mm-hmm.
or you are bending and lifting something heavy,
Yeah.
this disc can give way, and a part of the disc can protrude out from between the bones, and it can pinch on the nerves coming to the leg, or it can impinge on the spinal cord. So this is what is a problem in an intervertebral disc prolapse. So this, it can be many stages. It can be just a bulge of, or it can be a complete piece of disc which has come out, a protrusion or a bulge, or it can come out and press on the nerve root, which is called as an extrusion. The intervertebral disc prolapse can be many stages, and the final stage is extrusion, where a piece of the disc comes out and it will be pressing on the nerve, causing severe pain,
Yeah.
often causing pain in the leg, which is normally called as sciatica, right? So this is the worst case scenario, but you can prevent all this
Yeah.
by doing regular exercises, getting a very good chair. You know, you need to have a proper ergonomics while you're working, make sure the levels of your chair, your system, your laptop, whatever is all in the same level, or it's very comfortable for you to sit. You should not be bending down and stooping, and you should have the chair should have a small arch support, right? So that arch support, because you can see the low back is normally bent a little this way, right? It's
Mhm.
concave. So
Yeah.
the concavity has to be maintained by a convex chair, right?
Okay.
The chair should have a back support. So
Okay.
these are some of the easy ways where you can prevent back pain. So the
Mhm.
cause I've told you, how to
Yeah.
prevent it also I've told you.
Sure.
Most important thing is exercise,
Yeah.
right?
Correct, correct, doctor. So, doctor, now moving on to very natural question which you have ended with. What are the some effective exercises or stretches that IT professionals can incorporate during their daily routines to this, reduce the lower back pain?
Right. So, coming to the exercises, what can be done and what shouldn't be done is also important. So, yoga is a very good exercise, which I think anybody should do for protecting their back, neck, as well as the minds. So, it's very useful. Yoga is definitely useful. The second thing is to do strengthen your spinal muscles. So there are two sets of spinal muscles. One is on the back, and then other is actually in the front. Your abdominal cores are very important. So strengthening your cores is very important for protecting your spine, as well as the spinal paraspinal muscles, which are the muscles just on the back, which are next to your spine on either sides. So these muscles will help you to strengthen keep the spine from any strains, sprains, or any difficult movements and all. It will protect it. So it's very useful, these muscles, to protect any problems for the spine. So again, yoga, there are some asanas which will definitely help and strengthen these muscles. So I think you can ask your yoga expert.
Sure.
I think Cureka has got many yoga experts also coming
Yeah.
and giving talks.
Yeah. Yeah.
You should ask them also for the
Sure.
spine exercises
Sure.
to protect the spine and the disc. So these are some of the exercises, and what we call as spinal flexion exercises and spinal extension exercises. I will share some videos on the Cureka platform about how these exercises are done. Spinal
Sure.
flexion and spinal extension exercise. The flexion exercises will strengthen your core, which are your abdominal muscles, and the extension exercises will strengthen your back muscles, which are the paraspinal muscles, which will protect both your disc and the spine.
Sure, sure, doctor. So, doctor, neck pain is also a prevalent issue among IT workers. What are the primary causes of neck pain in this profession, and how it can be like managed?
Yeah. So neck pain also is due to very poor posture. Many of our IT professionals work with laptops,
Yeah.
right? So the laptops, they put it on the table, and they have to bend down like that and watch this thing, or sometimes put it on the lap, which is even worse. Even a table, you have to bend
And
down
doctor,
more.
sorry to interrupt you, but these days people are working from home also. So they
Yes.
keep their laptop on their lap and very bad posture.
In fact, working from home, they put the laptop everywhere. It's
Yeah.
on the floor, and they'll be lying on the bed and working on
Yeah.
that.
Yeah.
They'll be on their tummies, or lying
Yeah.
down and doing it, so like putting on the side and put it like that, and lying down and working. So these are very bad ergonomics for the neck, right? So laptop usage should be very clear. You should not have the monitor on the side. Should have it on the level of your eyes. Make sure the laptop, your screen is tilted so that your eyes are in level with it. Do not watch it like that or watch it like that. So people with double, the vision problems, the hypermetropia, they should not keep your necks like that and watch like that.
Correct.
Or so it should be, if you then put it on a stand. Nowadays you have commercially available stands
Correct.
which will help you position the laptop correctly. And definitely the position of the laptop matters, position of your monitor matters. Make sure they are all in one line. For professionals, keeping the monitor on the side and then working like this will have immense pressure on the neck. So that should be in the same level. Do not put it on the sides and watch and work. Another important thing is now people are working, talking on the phone.
Yeah.
So they put a phone here on the side and then working like that.
Yeah.
So that's a lot of pressure on the neck. So it's like putting a 25 kilos on your head, and that's the kind of forces which go down your neck. So this can lead to a lot of pain, strains, and also, like I told you, there are intervertebral discs in this neck also. So these discs can also bulge out and cause pressure over the nerve and can pinch these nerves. And the nerves from the neck run down your shoulder right up to your fingertips.
Mhm.
So if there is any pressure on these nerves, these pain runs down even down to your fingertips. People can get numbness. They'll get kind of jum jum kind of feeling, and then there is sometimes if the pressure is more, there can even be weakness of some of the muscles. So it is very important to recognize this earlier stage and not let it go. So in the course of completing a project, you should not spoil your neck.
Correct, correct. Thank you so much for sharing that, Doctor. I'm sure that is very helpful for our listeners. And guys, if you have got any question to ask from Dr. Sathish Devadoss, he's here, and please do share your questions, and we will try to take them up during this live session. Or if this is over, then we will request the doctor to answer your question. We'll try to share them in the comment section below. Now, Doctor, could you please share some practical tips on ergonomic recommendations? We have been talking a lot in this talk about ergonomics for setting up a comfortable and posture-friendly workplace to reduce the risk of both neck as well as the back pain.
So first, coming to back pain, because we
Ji.
talked about it first.
Hmm.
So always have a very good chair, and even if you're working from home, buy a good table and
Hmm.
chair which is designed for IT professionals.
Hmm.
Where, like I told you, it should have a back support, a
Hmm.
convex support on the chair, which will cradle the low back,
Hmm.
and it will prevent it from bending this way.
Yeah, yeah.
So it should be used regularly.
Hmm.
And like I said, you will need to put your laptop or your computer
Hmm.
straight. So
Hmm.
that will reduce a lot of strain on the neck. Make sure your eye level and the monitor
Hmm.
are the same. Working from there is important. Some IT professionals get another condition. I'm just moving slightly away from neck pain and back pain, called as carpal tunnel syndrome, where because of constantly keeping your hands like this and working on your
Hmm.
keyboards,
Hmm.
you can get pressure on your nerves here,
Yeah.
right?
Hmm.
It's called as a median nerve. There's a tight compartment there, and keeping it in the same position for hours together and working can cause pressure on the nerve, and the nerve can cause tingling and numbness in your
Hmm.
hands. So many times this will this can be controlled with medicines, physiotherapy.
Hmm.
But if you have constant pain, then sometimes you may need to go for surgery also.
Hmm.
How to prevent this is to have a support, a cushion support before the keyboard, that
Hmm.
so that your hands are not always in this position. You can keep it in a neutral position and type it.
Hmm.
So have a cushion support. That is for
Hmm.
carpal tunnel. So all
Yep.
this together should improve the ergonomics. So for the your back chair, you
Hmm.
need to do your eye level for the monitor, as well
Hmm.
as your keyboard support for your palms, so that
Hmm.
don't develop carpal tunnel syndrome. And
Sure.
very often you should be getting up and walking. Like I told, some nowadays many people prefer to be standing up and working. So that way, it is going to be even better for the back because their strain going down the intervertebral disc is very much less. And it's better to stand, stretch often.
Right. So, doctor, there is a question coming in from a listener. His name is William. William, first of all, says, "Good morning, doctor. Very useful topic for IT professionals." And then he's asking a question which says that for obese people, they sit for longer time on computer and they get some leg swelling as well. So, my colleagues face this, and what can they do?
So, for obese people, many of the problems are because of obesity by itself, right?
Correct.
So, why they do get swelling is the veins from the leg have to pump back all the blood to the heart, right? So, apart from they have these valves in these veins, so they have to work very well. So, there are some smooth muscles in your veins, right? So, this will take the blood back to your heart. But in obese people, because of the fat deposition and others, these veins do not work very well. And what we call as stasis, that is, the blood and the fluid in your leg gets static on your legs and doesn't get pumped back to the heart. So this leads to the swelling. This can be due to other factors like varicose veins and obesity related issues where the veins can be compressed by your abdominal fat inside your abdomen or the thighs. So, all this can lead to this kind of swelling. So, my advice to them is to first check whether they have varicose vein, which is a problem. So you need to probably wear a stockings or take some medicines in the initial stages. And if the swelling if it is not due to varicose vein, better to keep moving your feet up and down when you're sitting. This leads to the calf muscles working and pumping all the blood back to the heart. So while you're sitting, also keep moving your feet up and down. That will reduce this fluid collection. And if you still feel that there is fluid collection, it may be due to some medical conditions such as high blood pressure or due to some heart problems. So it would be better to check your physician whether there are any medical reasons for this increased swelling in your legs.
Right, right. Thank you so much, doctor, for that. William, I'm sure you would have got your answer. In case you have any other question, please do let us know. So, doctor, many IT professional, as we discussed, they're relying on laptops and mobile phone devices. You mentioned them just a while back. How can they maintain good posture and reduce the strain on the neck and back while using both phones as well as laptop? What can they do?
Yeah. So, like I had explained earlier, laptop has to be at your eye level, the monitor. Do not put it on your lap and work. Or do not put it on your bed, floor, and on any posture. Do not work on it. Work on it like as you're sitting in your office, on your desktop. And if you feel that the laptop is very low, your table is low, put some books and keep it at your eye level
Eye
and
level.
work on it. And if you're using your phone as well as your this thing, better wear your hands-free kit.
Hands free.
Do not put your phone on your neck and on your ear like that. Hold it like that and talk. That's going to be really bothersome. And so use your hands-free. It's nowadays not so expensive. 100, 200 rupees also you get these wired hand pieces, hands-free pieces. So you should use them if you are using a phone as well as your computer. Like I said, laptop is we should probably rename it as not a laptop. We should put it as a mobile desktop is what I think we should call it.
Correct.
Because
Correct.
the laptop should never be kept on a lap and
Yes, yes, right, right. And a lot of these IT professionals, they also suffer from a lot of anxiety and stress, depression these days because, work pressure comes into play. They have to manage. And sometimes, especially they're working from home, the pressure gets increased because, always the bosses think that they're available, calls go on the odd hours and everything. So what they can do to maintain their good healthy living, I mean, especially with good in number of anxiety and depression cases, people are finding it very difficult to have a good night's sleep. So what can they do about it?
yeah. See, moving a little away from
Yeah.
orthopedics, this mental stress and depression due to work pressure, actually, there is a linking of neck pain and back pain to that. So we call these as psychosomatic disorders, where there is a mental part of this due and causing pain. So these are called as psychosomatic disorders. Nearly 25%, 25% is quite a big
Yeah.
number is because of this issue, right?
Mhm.
So psychosomatic neck pain and back pain can be caused due to depression as well as work pressure. So it is mandatory that you should do meditation,
Yeah.
do breathing exercises, take breaks often, do stretching, and doing all this yoga and meditation will improve your good hormones in your body.
Yeah.
And it's not that if you're working from home, your boss is not going to call you at 6 in the morning. So you can go out for a walk or a jog at 6 in the morning, do your exercises and yoga. And all this can definitely help you get away from your work pressure, depression,
Right.
and,
Right.
and in turn, neck pain and back pain. Because I told you, this
True.
depression and mental agony is also cause for neck pain and back pain.
True, true, true. Thank you so much, doctor, for that. And William has responded to us saying, "Oh my God, it's not just obesity." Thank you so much for the awareness, doctor, and waiting for many more such informative videos from you. Thank you so much, doctor. Also, a question comes from the listeners. Then, when they want to ask, like, how good are these? You can say nutrition aids or supplements when we want to reduce our anxiety and stress. Do they also sometimes help you to reduce anxiety and probably have a good night's sleep, or we should avoid them? I know what is the strategy? What we should do?
Right. So there are a lot of herbs or Indian herbal remedies which have been professed to have uh, mind calming effects
Yeah.
without side effects.
G.
So definitely, I have found in my practice some of the mind calming herbs like ashwagandha,
Yeah.
valerian root extract. All this definitely do help people. I've seen it working with ashwagandha. There are chemicals also like melatonin can give you decent sleep. Your quality of sleep improves. So there are some brands coming out with melatonin and in very easy formats like strips, gummies, and that's instead of like taking it like a medicine, you
Yeah.
can take it in a very natural, in a like a sweet. You can like a
Yeah.
gummy format,
Okay.
which with the melatonin, ashwagandha, valerian root extract, all these can definitely calm your mind and brain. And along with yoga, meditation, uh, I do see people definitely getting away from this stresses of
Right.
IT functions.
Right, right. Thank you so much, doctor, for sharing that. Now, doctor, moving on, we've got just a minute left. So, last question for the day, doctor. So, are there any warning signs or symptoms of neck and back problems that IT professionals should be vigilant about, and they should seek medical attention because of these red flags?
So the first sign or symptom of neck pain or back pain would be a sore back or neck pain, which means that the muscles around the neck and the back are in spasm, and that can lead to decreased movement. People will not be able to move their neck completely, or bending down to take something may be difficult. So soreness and muscle spasm is the first issue. So if you get that, people just say, I have a small crick in my neck, and I slept a little badly or something, but it may be related to your disc problem. And in the older age group, post 40, people do get what is called as cervical spondylosis or lumbar spondylosis. Spondylosis is nothing but degeneration of the disc as well as the bones around it. So this degenerated, that is wear and tear of the disc occurs, and the disc can bulge out along with the sharp bones, which can press on the nerves, like I explained earlier. So here again, people will complain of back pain or neck pain. So these are the first symptoms: sore neck and a sore back with difficulty in movements. And so be aware of these things. And the next would be to have shooting pains, especially when there is a nerve impingement, right? So the shooting pain comes from neck down to your arm, or from the back down to your leg. That's a sciatica. This can also cause, this may be also the reason, symptom of back and neck pain.
Right. So one last request, doctor, if you can share what steps people can do, how they can get immediate relief from the small pains or neck pains they are having, and to avoid, larger pains in future also. So what the IT professionals can do.
I will share some videos of spinal exercises
Sure.
on your platform. But however, for the neck pain, I can show you even right now a
Okay.
couple of simple exercises each and every IT professional should do.
Sure.
So this exercise you can do every hour in
Okay.
between your work.
Yeah.
It hardly takes 20 seconds, and it is very useful to strengthen your neck muscles. So this is called a shoulder shrugging and bracing
Sure.
exercises.
Okay.
So first you clasp your hands like that.
Okay.
You
Mm-hmm.
can just shrug your shoulder up and down,
Mm-hmm.
right? So this is
Yeah.
the shoulder shrugging exercise.
Mm-hmm.
10 times you do this, okay?
Okay.
Then you hold your hands above on the level of your chest, right?
Mm-hmm.
And your arm, if you can see a little, go a little back, yeah.
Yeah.
If you can hold it up like that
Yeah.
and brace like that.
Okay.
Take your arm back, as far back as possible.
Yeah.
So these two exercises, 10 times is shoulder shrugging, clasping your hands like that,
Mm-hmm.
shoulder bracing.
Yeah.
Okay, these two exercises, if you do on a regular basis every hour, you
Yeah.
can strengthen your neck muscles. Hardly takes 20 seconds, 10 times each. So this will definitely prevent, and also it will help people who are already having neck pain.
Thank you so much, Doctor. This is a wonderful insights. And a lot of listeners, in the next session, we would request you also like to know how to keep your bones and joints healthy as young as possible, because people do not want to age; they want to stay healthy. You have to please. You have got a lot of expertise, insights into keeping the bones and joints healthy as much as possible. Please, our request to let us take them up during our next session. And thank you so much for joining us today, and wish you a very, very happy weekend, Doctor.
Thank you. Thank
Thank you.
you.
Thank you.
Wish all Eureka viewers a happy weekend too.
Thank you. Thank you so much, Doctor. So, guys, this was Dr. Sathish Devadoss, Vice Chairman of Devadoss Multi Specialty hospital, on very renowned orthopedic surgeon who has taken care of thousands of patients, not only from South India, not only from India, but from many countries of the world. He speaks in multiple conferences, has been recognized by multiple bodies for his great work in taking wellness and care. So you got idea about how you can take care of the your neck and pain, especially for the IT professionals. So if you have got any other concern which you want to take, help us to take in the next live session, please send your messages, please share your comments in the comment section, so that we can try to take those questions in the next live session and we can plan accordingly. Guys, please log into cureka.com and please give us an opportunity to serve you. We have got multiple discounts, multiple offers running in right now, which you can use to get your favorite product. Also, we have got very highly regarded health etc nutraceutical gummies. These gummies are available, which are sugar free, even a diabetic can take it, and this will help you to reduce anxiety, stress. And we have got multiple gummies from health etc. Some are for elderly age women that can help postmenopausal women. And then there is immunity gummies. So a lot of people, you get sick quite often, will help them to get a better supplement to take care of their immunity. Gummy on the go has got multivitamins, and hair health gummy has got great ingredients for keeping your hair healthy. So do check them out, and there are multiple offers going on right now. Let us know your feedback and comments. What do you think about those products? And do check out the WhatsApp platform where you can get free of cost advice. Guys, this is Rahul Anuhal, your host for today, signing off, and wish you a very, very happy weekend. Take care, guys, and have a great weekend.